Okay, right. So let me just give you the overview of the exam. I know that we all know about the exam, but still, we are not doing much in regards to management. Why the people are not getting chance to finish management in time? Has anyone got any idea why? Well, yes.
Maybe spending too much time on the history.
Yes, that's right. Because we are spending too much time on the history and we are asking too much things to rule out, which is not necessary. So this session is just to give you tips and tricks, and then we will do 2 mocks. So, in the exam, if you stick to your point, if you stick to the complaint, right? Suppose if the patient is coming to you with headache, okay? Now, you need to ask, first of all, about the pain, isn't it? Yes. So when you ask Socrates, there are eight parts of Socrates: site, onset, character. You need to ask everything. Believe me, because this part is very, very important in the exam, and examiner is checking you whether you are completing your Socrates for pain or not. Because when you ask this question, you definitely rule out few of the diagnoses there. If you ask if the pain is radiating somewhere, okay, so in terms of your history, just stick to your Socrates and ask the things which are in the head. Just suppose if patient is coming with headache, look at his head and think, okay, I have to ask about the eye. One question: do you have pain in your eyes? No. Do you have any temperature to rule out meningitis? No. By any chance, did you hurt yourself to rule out any trauma? Finish. By any chance, do you have any weakness in your arms to rule out TIA? Are you getting my point? Hello?
Yes, doctor, we're getting your point.
Yes. So see, that's your DD's finish. You don't need to ask further. Just ask which system the patient is coming with complaint of. Remember this. If it's coming with the tummy pain, just look at the tummy. Imagine in your head what's in the tummy. In the in the tummy, you have got stomach, you have got liver, you have got pancreas, you have got your bowels, you have got your bladder, you have got uterus, ovaries in case of the female. So ask only those questions. Are you following me? See, that's how you will cut short your history. Okay. And always, always, always ask concerns when you finish your P1, because nowadays they are having concerns.
Recording in progress.
They are having, sorry. So they are having concerns in every station. Okay. And after this, you don't need to ask any things which is not necessary. If it is acute condition, don't ask DESA. Okay. And as far as the Maftosa is concerned, just ask 3 questions: any medication, any allergies, any family history of heart problem, or suppose the kidney problems or any other problem. You are finished. Yes.
Yes, doctor.
Okay. Now I'm going to tell you very, very important thing. Like you ask, you follow your history, P1, P2, P3 Maftosa, this, okay, then when you go for examination, you do your examination, you need to make changes to your approach. What I'm going to tell you now, it will help you and will help you to finish your station and your management in time. What you need to do is, when you do the examination, when you verbalize, I will be checking your observations and I will be checking your tummy whatsoever. You need to verbalize basic investigation here, not in the management. Are you agree with me this on this point?
Yes, doctor. Yes.
Yes, because if you ask basic investigation here, they will give you the folders with the results, either positive or negative, whatsoever. It will help you to make your provisional diagnosis, and then your management will go into a flow. You will involve the senior, you will refer the patient to a specialist who will do further investigation. If he's having some pain or something, you will give him the basic treatment. Okay, then follow-up appointment, leaflets, safety netting. See, your station finish. But if you don't ask, sorry, yes, if you don't ask investigation with examination, you give your diagnosis on the basis of history. When you come to management, if suppose the patient is giving you something else which you didn't say in your provisional diagnosis, you will not pass management. You will get 0 in the management. Am I making sense so far?
Yes, doctor.
Yes. So,
Yes.
Doctor, could you
yes,
please repeat the last point that you said?
I didn't get the last particle said, please.
yes. So I said, see, we know the history, we know the management, I know, but if you mention basic investigation with your examination, when you verbalize, I will be checking your observation, plus I will be doing this examination, and I will be sending some basic investigation for you. Okay, then the simulators, they give you a folder. You will get an idea what he's having. You will think what he has told you and what you have got the result with you. You can give your patient provisional diagnosis, which is according to the investigations and your history. Okay, right? If suppose you don't do investigations earlier and you have given your diagnosis, you come to management, you come to investigation, then they give you folder, your time has already gone. You might be having only 1 minute to finish your station. Then will you go back and change your provisional diagnosis? No,
No, no.
you will not
I
go.
understand. No.
So make this habit, make some changes. You will see that, this will help you. And this is the right thing to do, not to ask the investigation when you have done everything. Ask with examination. They will give you a folder and then give you a provisional diagnosis, and then management will automatically flow.
Thank you.
Thank you. Understood.
Thank you.
Yeah. Okay. Like, let me, okay, because I will give you, we will do a case today. You will see.
Doctor, what about specialist investigation like CT scan or MRI or endoscopy?
Yes. See, you don't need to mention everything. When you, Dr. Lokash, I will be answering your question. Can you please mute yourself because it's making noise? Thank you.
Okay, doctor.
Yes. So, see, as an FY2 doctor, our basic job is to do the basic things for the patient. Basic investigations, basic treatment. But when we need to refer the patient, we can just only say, okay, because I need to refer you to a specialist who will do further investigations for you. You don't need to mention CT, MRI, endoscopy. If the patient asks you, okay, doctor, what they will do for me, if it is case of GIT, suppose the bleeding, you can say they might consider doing a camera test for you or a scan of the head for you. Don't say CT scan. Yes. So you don't need to worry about what specialists will do for them, because no, they see, believe me, this exam is not about your knowledge, it's about only the knowledge you have as a doctor for basic things. And other thing, you need to know the culture of the UK, you need to know the ethics of the UK, you need to know the problems which are common in the UK. That's what you are checking you on. They are not checking what you know. Do you know endoscopy? How is the? No, they don't need to know anything from you. So these are the things which you need to consider. And when you do the management, try to involve your patient, because if you finish your history in 3 minutes time, focused history, no questions which do you think are not related to the condition, don't ask them, omit them. Then you get time to involve your patient in the management. And always, always, always ask the patient. If you give them medication, painkiller, you say, well, you are in pain, I'm giving you this painkiller, is it okay for you to have this? See, this is your IPS and you involving them. Okay, don't say that, okay, I will give you painkiller, I will do this for you. No, involve him or her. You will get good marks in IPS. Everything you do for the patient, involve and ask the concern, please, concern. And in acute condition, there is no need to ask about the ideas or expectations. Okay. So any other questions so far?
Yes, doctor, it is important to ask like social history in acute condition.
No. Why? If the see if you are in emergency, patient is coming to you with the chest pain, you don't need to ask social history. You can just ask, how do you come to the hospital? Do you want me to call someone because I'm sending you to the sorry, if you are in the GP, you can ask, how do you come to the surgery today? Do you want me to call someone for you? These small things, they will make a huge difference in your consultation. So that's social history is important when there is a child involved and when there is an elderly involved. That's where it is must to ask the social history from them, whether they are safe at home or not, whether they are able to look after themselves or not. Social history is not important in every station. Okay.
Okay, doctor.
Okay, no worries. Okay, so any other queries? Okay, so someone posted in the group that they are confused about the gender dysphoria or sexual orientation. Okay, so have you got any idea what is gender dysphoria?
Um, yeah, basically when the patient is of certain gender and he doesn't feel that way, or he feels like a different gender. Like if it's a male, he thinks he
Yes, that's right. So means he is not feeling good in himself. He is
Mhm.
not satisfied with his body. he want to change the body, isn't it? So this is dysphoria, means he is not satisfied with his gender. He wants to change it. While orientation is something different. Orientation is, I'm a boy.
Sexual.
Yes, that's right. Okay, Dr. Amrita, say something.
Yeah, sorry, I cut in between. Basically, sexual orientation, that he likes a boy or he likes a girl, or yeah,
Yeah,
the like both.
sexual orientation means that, well, I like, it means then at some point in my life I feel that, now I am attracted to the girls. Now I feel that I'm not that person anymore. I'm a different person now. I'm not having that sexual connection with the opposite sex. I'm having the sexual connection with the same sex. Okay,
Yeah.
so yeah, so in both the stations, you need to rule out uh, mood, depression. That's very important, because you will not do anything for them. You just need to be nice to them. You need to make a good connection to them. If suppose there is a 14 years old there or 16 years old, just talk to them like you talk to your own child in a very low tone, make them understand, and pay attention to their, how they are sitting, how they are looking at you. So reflect, react. This is the main thing for these type of scenarios in the exam. You need to reflect, you need to react, you need to address, acknowledge them. Okay. And like, yes.
Well, yeah, but so yeah, that is all okay. As in, history taking part in all gathering and being empathetic and listening and everything.
Mhm.
But for management, are there certain pointers like social groups is one thing and it's acceptable in the society, and talking therapies is one thing. But other than that, is there anything more we can offer to them? I don't know.
Yeah, if it is the gender dysphoria clinic and the patient you are having is under 16, then you need to refer him to gender identity development services.
All right.
Okay, because they are under 16, you have to refer to them there,
All
because
right.
under 16 they don't have, because they don't think properly. So gender identity development services, it includes, uh, psychiatrists and mental health services, social workers and endocrinology. So they will deal with them, they will do assessment for them, they will do investigation for them, and then they will manage them accordingly.
Okay.
So that's the management for them. Refer them to gender identity development services, and refer them to support groups like LGBT community, broken arrow community.
Mhm. All
and
right.
and you must ask about their social life. This is, see, social life is important here. You need to ask about the home conditions and friends, family. So basically here you have to do the bit of McFamish.
Okay. Psych history, basically.
Yeah, because these patient, they come because when they are not happy with themselves, they must be under some sort of anxiety, some sort of depression, isn't it? So you
Yeah.
need to make sure that they are safe. You need to rule out suicide as well.
Mhm. All right. Yeah. Mood and society, and then have what else?
Yeah.
Right. All right. Thank you.
No worries. Okay, so who is having exam in the coming week? So nobody.
I have on 11th.
11th of June.
Yeah.
Okay, so would you like to do a case?
Yeah, I can try. Yeah. I like to try. Yeah.
Okay, sure. Can you see the screen?
Mm. No. I can only say participant. No, the screen is blank.
Now you see it?
Mm. Nope.
Hold on a second. Now you see it?
Yeah, it's yeah, I can see now.
Okay. Read your task and then we talk.
All right.
Okay. Okay, I don't. I will have. I don't have the GMC timer now, but can someone please put the timer if they've got the GMC one? 7.5 minutes, please. I will have to look. Okay, let me put myself.
I have the.
Okay.
Hello.
Hello.
I'm Dr. Amrita, junior doctor in this clinic. Can I know your name and age, please?
Yes, doctor. My name is John, and I'm 52 years of age.
All right. Nice to meet you, John.
Thank you, doctor.
Okay. So tell me, how can I help you today?
Yes, doctor. You know what? I was watching the telly in the morning, and I had chest pain. And it was so severe, and I stopped there. And then after 2 hours,
Uh-huh.
it has gone. But I'm just worried about it. My wife told me to go to see a doctor, so that's why I'm here now.
Okay, I see. And are you comfortable to talk right now?
Yes, doctor. I don't have any pain now. It was in the morning.
Okay.
Yes.
So can you just tell me a little more about that?
Yes, doctor. I was just watching the telly, and I was not doing anything special, just watching my favorite show in the morning. And I felt the pain, and it was like something was sitting on my chest. And I I called my wife, and she was worried. And then I just wait. She said to me that just lie down, maybe because you are drinking too much of the coffee, that's why you're having the pain.
All right.
Yes. Yes,
So
doctor.
that's very disturbing for you, John. Don't worry, we'll just look into it and see how we can help you. So you were telling me you had it in your chest. Any particular location in your chest?
Yes, doctor, like in my heart, where my heart is.
On your left side, that is.
Yes, doctor.
All right. And tell me, did the pain go anywhere? Did it go towards your shoulder or your jaw?
Yes, doctor, I feel the pain. It goes to my neck area and my hand. Yes.
Mhm. Okay. And did anything make it worse?
No.
Anything made it better?
No, doctor, it just gone by itself. I didn't do anything.
All right. So you didn't take any kind of medications or anything.
No.
Mm-hmm. And can you like score your pain for me on a scale of 1 to 10, 1 being lowest and 10 being highest?
Yes. It was 8, doctor, at that time.
Oh, I see. That must have been very disturbing for you. Don't worry. All right. So can you tell me, did you experience anything else along with it?
I just felt that my heart was racing. That's it. Nothing else. No.
Your heart was racing. Okay. And it was only for that duration.
Yes.
And did you have any sweating?
No.
Did you feel sick, or did you become sick?
I felt being sick, but I didn't vomit.
All right. And okay, so and apart from this, how's your health been recently?
I'm fit and well, doctor. I don't have anything else, I never been to
Uh-huh.
doctor before.
Any fever?
No,
Any pain in your legs?
no,
All right. And has anything like this ever happened before?
no, doctor.
Okay. And do you have any other medical illnesses?
No,
Okay. Any diabetes?
no,
Any high blood pressure?
no,
Do you take any medications?
no,
Any allergies to anything? Any medication or food?
no, doctor. I'm fit and well. I don't take anything. I do my exercise every day. I'm fine.
Well, that's good to hear,
Mhm.
and it's very encouraging. I just need to ask you a few more questions so that I'll be at a better position to help you. Is that okay?
Yes, please.
Yeah. So, do you take any other family history of something similar?
Yes, doctor. My dad, he has a heart attack. Yes, 2 years
Uh,
back.
I'm so sorry to hear about that. How is he now?
Well, doctor, he died. He couldn't make it.
Oh, that must have been very sad. I'm so sorry to hear about that.
Okay,
Don't
doctor.
worry, we'll take care of you.
Mhm.
Okay, I need to ask you a few questions regarding your lifestyle. You told me you're physically active. So, what kind of activity do you do?
Well, I take my dog to the walk, every morning and in the evening. So because I'm not working because uh, my kids, they are really good. So they are helping me, and so I'm just at home. That's it.
That's lovely. It's very rare to see all that nowadays.
Mhm.
So, do you smoke, John?
No, doctor, no.
And do you take alcohol?
Uh, Sometime on the weekend with the family.
Okay, that's really good.
Mhm.
And are you working? You told me you're not working, right?
Yes.
Just all right. So thank you for answering those questions. I need to
Yes.
do a few investigations and examination for you. And I need to check your heart rate, respiratory rate, blood pressure, and temperature and oxygen saturation. I
Mhm.
also need to look at you generally from head to toe and run a few and see your chest, specifically your heart.
Mhm.
And I'll also need to do a few investigations. I need to take your bloods for routine checkup, see your salts, and we need to send a special test called as troponin to check your heart. And also, I will need to do a ECG to check your rate and rhythm of your heart. Is that okay?
Yes, doctor. Yes.
Mhm.
Everything is fine.
All right. So, John, from the chat we had in my investigations, it appears that you had an episode of angina. Do you know what that is?
Doctor, it is a heart attack.
Well, I know you're concerned, but let me just tell you that it is not a heart attack. It is, your heart needs blood supply, and sometimes because of some reason, the supply gets reduced to your heart,
Mhm.
and it's a transient event, and that is what we call as angina. But we do need to look at multiple things to help you so that it doesn't become something more serious.
Okay.
Okay, so we checked your ECG and it's normal. And however, I'll need to do a serial troponin to rule out anything more sinister. Till then, I'll keep you under observation. However, I'll be giving you a medication we call mini aspirin.
Mhm.
You need to take it regularly.
Mhm.
Also, you'll need to take. I'll give you a spray whenever you feel this pain. You can spray it at your tongue.
Okay.
Okay. And at any point, if you have a heart pain longer than this, please come back to us. Thank you.
Thank you, doctor. Thank you, doctor. Well, thank you, doctor. You did really nice. Well,
Mm,
you'll see your IPS good, your history good, but you take long time after,
when-
Socrates.
Yeah.
And you know what? I will you will fail this station
I admitted the patient that for observation.
because you don't know where you are. You are in the GP surgery.
Yeah, I didn't want to do the ECP.
No, you don't need to do troponin, serial troponin. You need to refer patient to the hospital straight away.
All right. Yeah.
And because I'll see, I'm sorry to say, because this station is really common in the exam. Patient is
Mhm.
only having chest pain. He is not having any other he is not having any other symptom. This station is not chest pain. This station is about patient refusing to go to hospital.
All right.
So when you ask him, when you say to him, I want to send you to hospital, he will say, no, I'm not gonna go to hospital.
Okay.
Because why? Because he has told you that his father has died, isn't it?
Yeah.
Yes. So you need to just, first of all, you need to think where you are. That's very important in the exam. If you are in GP, you will not be able to do the serial proponents. You need to
Mhm.
refer him. He is not having any pain at the moment. We will not do anything. We will refer him to the hospital to do the further investigation. Here, his main concern, you need to ask the concern. See, you have forgotten to ask the concern.
Yeah. Yeah.
And
Two.
and yes, sorry, and one more thing I tell you, when you say investigations, just
Mhm.
remember, don't say everything. Say the investigations which are specific to your complaint. You will save your
Okay.
time.
All right.
Don't say ECG, say heart racing, heart attack
Mhm.
marker, infection marker, to see your full blood count. This you can see. That's it. Or if we need, we might need to do some other investigations for you. Basic investigations. Okay.
Okay.
Don't
Mhm.
say ECG. Don't say cardiac enzyme or troponin. Heart attack markers. Make simple words, simple things.
All right.
This station is refusal of admission patient. So keep this
Okay.
in mind.
Mhm.
Patient will not give you any history positive. All things were negative, only chest pain. So the thing is the concern, and his concern is he is did not want to go to hospital. He will say to you, doctor, I want to go to a clinic
Okay.
because he had a bad experience in the hospital because of her father. He doesn't want to go there. You try to make him understand. You tell him, well, if you don't go, you might have another attack. It might be possible there is some blood clot in your body. You might be having some stroke. So I'm really worried about you. I want to send you to hospital. But his concern is that he don't want to go to hospital. He want to go to a clinic. Okay. So write down, there is a clinic where
Mhm.
if the patient is reluctant to go to hospital, we send them. Okay, this is called as rapid access chest pain clinic.
Okay.
Okay, rapid access chest pain clinic. This clinic is only for the patients who had the chest pain, or GP refer patient from the surgery to them so that they can be evaluated further, and if they need further treatment, then they will do the further investigation.
All right.
Okay, so this station is quite common in the exam, and his only concern, he say, I don't want to go to hospital, I want to go to clinic. So you first of all try to make him understand to go to hospital. You don't say the name of the clinic till the end, but when he say, no, I want to go to clinic, you can say, okay, I can send you to the clinic, which is called as rapid access chest pain clinic. There are nurses there, specialized nurses there in the heart. they will check you, they will examine you, and they will do further investigation for you.
Okay.
Got it? Yes.
Yeah. Ask you, like, I wasted all the time in.
Yes, see, because you have I told you earlier that if it is patient is coming with acute condition, like he had chest pain 4 hours ago, so he need to be seen by the by the in the emergency soon, isn't it? Because he needs to have his troponin done.
Yeah.
So we don't need to ask. You can just ask, do you smoke? Finish. Alcohol, exercise, diet, not important here. And in the maftosa, just ask medication, allergy, family history, finish. Don't ask occupation, don't ask what he do, no. Because I have already told you I am retired, that's it. And I have told you that I take my dogs to the walk, so you don't need to ask about exercise. You have already said to me, very good, isn't it?
Yeah.
See?
Fine. Yeah.
Yeah, so
Mhm.
don't repeat same thing. Try to make your history short, stick to your point, which the things which are not necessary, don't ask.
Just one point that I wanted to make, like, yeah, so this case was acute and they had to take him, but sometimes what happens that it's not exactly a acute case, and then you need to refer, you need to do a little bit of lifestyle modification, and that is why I was elaborating on the social history
Okay,
part.
so see, that question is different. When they ask you need to talk about him about lifestyle, then you will have to focus on desa.
All right.
This question is saying address the concern and discuss further plan of management.
Mm.
So
Got
read
it.
the question, you will see, because that station which you are saying, that's the counseling station. This station is a medicine station.
Yeah, fair enough. All right.
Yeah.
Thank you.
Okay, no worries. Okay, just try to work on the history short. Don't ask too many questions in the DESA or in the Maftoza if they are not necessary. And investigation, just try to mention the investigation of the particular system which you need to do, which you can do.
Okay.
Okay, and try to use simple words and read carefully where you are.
Okay. Yeah.
Yeah, okay, thank you so much. You did well. Your IPS is very, very good. That's really good. But try to just work on these. You will be fine, inshallah. Don't worry.
Hopefully, let's see. Thank
No,
you.
no, you're fine, inshallah. Don't worry.
Yeah, I have a
Okay,
question,
so
please.
I have a question. Okay.
Yes.
Okay, I think Fidjur should go first. Dr. Fidjur should go first.
Okay. I wanted to ask, before sending the patient to the hospital, okay, what are the basic investigation as you are supposed to do in GP surgery? Is it the full blood count, liver function? Can you do all those before you send the patient to the hospital? And also, can you also say, would you want to know the investigation that will be done for you by the specialist? Then you now tell the patient um the investigations that will be done, like the heart tracing and the cardiac enzymes. Can you
Oh,
do that?
well, in the
I hope you
GP,
understand me.
yes. In the GP
Thank you.
surgery, sorry, yes. No worries. In the GP surgery, you can do investigation, you can do ECG, isn't it? You can do blood test. Yes, because it is the hold on a second. Sorry. So yes, you can say the basic investigation. If the patient is coming with chest pain, say heart racing, I will ideally have to check and the enzymes, because you can't check the troponin in the hospital. Sorry, you can't check the troponin in the GP surgery. You have to
GP,
send it to
okay.
hospital. Okay. And in case of
Okay.
the senior specialist, don't say, if they ask, then mention. If they don't ask, say, I
Okay.
will be referring you to specialists who will assess you and who might do further investigation. Your job is finished there.
Okay. Okay.
If they ask what,
That will save time.
yeah, it will save. If they ask what they will do, then you can mention them. Otherwise, no need to waste your time.
That's good. Thank
Yeah, and see, in the investigation, I told you, don't say all of investigation. The investigations which are related to the patient complaint. It will save your time. Okay.
Dr. Shaz,
Mhm.
so concerning the since you said we shouldn't say troponin, we can say heart markers, right?
Yes.
Since it's going to be done in the hospital and the patient is at the GP surgery and we're
Mhm.
going to send patient to the hospital, do we now still need to state that maybe when you get to the hospital they would do some heart markers for you? Because I think that's like a basic investigation in this station, and if we don't mention it, like, won't it be a problem?
Yes, see what I say to you, say it. Well, see, because the troponin you will not be able to do, but you mention, just say I will be doing your heart racing, and ideally I will have to check your troponins, your heart,
Okay,
sorry,
okay.
your
Ha-
heart attack markers.
Heart markers. Okay,
Yes, because
okay,
he had chest pain, now he is not having. You can say, well, I have to refer you to hospital because they will check your heart attack markers every 2 hourly to make sure everything is okay with you, or to make
okay,
sure we are not missing out anything further.
okay,
Yeah, like this.
okay.
Mm.
Hello.
Well,
Yes.
my questions were similar. Was similar to that of Dr. Fejiro and the other doctor that spoke. So I got most of my answers already. I know we cannot admit in GP clinic.
No.
What other thing can we not do in GP clinic? Because I know that you cannot admit. That's a sure thing, no matter the station.
Sorry, I
So what
didn't
other thing is
get you. Sorry, doctor.
we cannot admit it. We cannot
No.
admit in surgery.
No.
Is there any other thing that is a clear-cut thing that we should know that we must not do in GP surgery? A critical error.
See, in the GP surgery, you will not be able to do chest X-ray. You will not be able to do ultrasound. Okay, because they all will be done in the hospital. But
Hospital.
yes, but you know, when you have a patient with some chest complaint, you say ideally, I will have to have your chest X-ray done. Just keep this word, because in the GP, if you are in the GP surgery, you are not able to do the chest X-ray or the ultrasound or the heart attack markers or the CT scan. You have to send him to hospital for these things. But
Doctor, what about like basic investigation like LFT, RFT, and CBC?
yes, you can mention them. If you have time, you can mention them. See, when it is acute condition, you say, I will be checking. Suppose the patient is coming with a pain in the abdomen. Well, I'll be checking your blood tests, including liver function test, kidney function test, infection markers, and I will also be doing a scan of your tummy. Okay, ultrasound.
Are these that blood test done in GP?
Yes, we can do the blood test in the GP surgery.
Okay. And doctor, do we need to verbalize this in every station, LFT, RFT, and CBC?
If it is necessary, you can say, just say, kidney function, liver function test. See, say two things together: kidney function, liver function test.
Okay.
Don't say and. I will be checking your bloods for blood sugar, kidney function, liver function, infection marker, etc.
Okay.
No worries.
Okay, thank you, doctor.
No worries. Okay, so who will do the next? Okay, so
My exam is in 10th of June.
sorry.
My exam is 10 June.
Okay, doctor. Okay, so someone has sent the question that what are those cases we need to refer to hospital straight away? Okay, so patient coming with the chest pain, patient coming with the pain in the eyes, okay, patient coming with some, nosebleeds which is not stopping. So those patient emergency conditions, you need to send him. Or a patient coming with the abdominal pain, severe abdominal pain, you need to refer him. Like there is a station in which a lady is coming with the hematemesis, isn't it? She was drinking alcohol, she was taking ibuprofen. So if she's coming to you, you have to refer her urgently because she needs treatment because there's a chance of perforation. Yes, we have, because see, if we don't take history, how we will know? Because if you are seeing the patient, they are comfortable to talk. So history management, you say I have to refer you to because I'm concerned about your condition. And then when you refer patient to the hospital, just make a bit of IPS. Say, how did you come to the GP surgery today? Do you want me to call someone for you? Okay. So these are small things you need to, like in the chest pain station, we can ask, okay, how did you come to, how did you come to the clinic today? If he says, I come here by driving, you will not send him on his own. You need to send him in the ambulance. Are you getting my point? GP surgery, they are same because here we call as a surgery. Here the clinics we call as GP surgery or the surgery. It's the same thing. Yes, Dr. Hayat. Okay, so let's do the next station. If who want to do it, Dr.
If I can. My exam is on 10.
Okay, no problem, Doctor. Hold on a second. Okay, so can you see the screen?
Yes. Yeah, I can see.
Okay.
Recording in progress.
Mhm.
Yes. We can start.
Okay, can someone please time for doctor?
Begin.
Hello.
Hello.
My name is Muhammad. I'm one of the doctors here in Adwatman. May I confirm your name and age, please?
My name is Sarah, doctor, and I'm 16 years old.
Nice to meet you, Sarah.
Thank you, doctor.
How can I help you today?
Yes, doctor. My mom is saying that, I'm sleeping all day and I feel tired, for the past 4 weeks. And I don't want to do anything. I'm just sleeping.
Sorry for the disturbance. Yes, we can continue now.
Yes, so I'm just feeling tired in the past 4 weeks, and my mom is worried about me. She's saying that I'm sleeping all the time, I'm not doing anything. I don't know what's been going on with me.
Okay. Can you tell me exactly, or can you elaborate for me more about this?
Yes, like, I'm sleeping all the time, doctor, day and night. I'm gaining weight and I'm drinking more and more water. I have to wake up at the night time to go to the loo. And I'm tired of, and then I get tired a lot. And I'm not eating much.
Do you have constipation?
No, doctor, no, I don't have any constipation.
Constipation.
No,
Okay. Hello?
hello, yes, I'm listening.
Yes. Some questions about your lifestyle.
Yes, doctor.
Do you smoke?
No,
Do you drink alcohol at all?
no, I'm just 16,
Okay.
doctor. I don't drink alcohol.
Okay. Can I ask you, when was your last menstrual period?
They were 2 weeks ago. They are regular, they are fine. No problem with that.
No heavy bleeding or something?
No,
Okay. Do you have any other complaints?
yes, doctor, because of this tightness and this, I'm not being able to do anything. I am missing my university classes and I'm not being able to go out with my friends. Can you please help me? Why I'm having this tiredness and this, this feeling?
And do you feel hungry more than before?
No, doc, no, I'm not eating. I'm just sleeping all the time.
Okay. I need to examine you, check your pulse, blood pressure, temperature as well.
Okay, doctor.
Do baseline investigation like full blood count, liver function test, kidney function test.
Okay.
Okay, and I need to check your blood glucose.
Okay.
And may I ask you if you have any family history of gland problems?
No, no.
And
Any-
sorry to ask that late. How is your mood lately?
Yes, like I told you, because of this tiredness, I'm not being able to do anything, I'm just at home all the time.
It must be difficult for you.
It is. So, can you see the investigations, doctor?
No.
Hold on a second. No? Can you see now?
Not yet.
Okay, so let me tell you because I don't know why. So the investigations are pH is 7.14. Okay.
Yes.
WBC is high, 19,000. Okay. Neutrophils
Okay.
and lymphocytes are high. And
Okay.
urinary ketones are positive.
Okay. And urinary ketones are also exactly. We are in the GB.
Yes.
I remember.
Yes, GP.
Okay. So from the history you gave me, from the examination I've done, from the initial investigation, looks like you have a problem in your glands. More specifically, thyroid gland. It's been quite not performing its function.
Okay.
So you have a low level of thyroid hormones,
Okay.
which has led to something is the tiredness and cold feeling and the weight gain you mentioned to me.
Okay.
And also you have some acids in your urine called ketone bodies, which may result from the thyroid problem. But what I need to do for you right now, I need to refer you to the hospital.
Okay.
So they can have better look on you. They will keep you for some time and do some investigation for you.
Okay.
And give you guidance, may be seen by a specialist.
Okay.
So you will be guided through the treatment journey as well, because the treatment of thyroid and its complication takes some time to be initialized, and there is a lot of options there.
Okay.
There are medication, there are surgery, and everything will be, you will know in details. But right now, what's important to me, that you came with your mother.
Yes.
So I need to tell your mother that it's urgent to go to the hospital right now.
Okay, doctor.
Because it looks like that you have ongoing infection, and this infection is causing these acids to accumulate inside your blood.
Okay, doctor.
And this is dangerous for you.
Okay.
Move on to the next station.
Thank you, Dr. Muhammad.
Thank you.
Yeah, thank you so much. Thank you. What happened, doctor? Why did you lose your structure?
I received a call from my wife.
Oh, I see. You okay?
So
Everything is okay?
I lost all the contact. I didn't even answer the call.
Oh,
maybe you give me some time to answer the call and see what is it about.
Okay.
And you can tell everyone what's I am listening to you, but I am just going to mute myself.
All right.
And
No
call my
problem.
wife about the problem.
I'm sorry.
Sorry for that.
Everything is okay with you and your wife.
I will be calling her and I will let you know.
Okay. 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 So doctors, can anyone tell me what is the case? Is
it DK?
DK.
Yes. Yes. See, DK.
It's DK.
DK. It's DK. She's telling you she's tired. She's going to the loo.
She's thirsty. She drinks more water. She's
Yes.
gaining weight.
Yes.
She's tired all the time.
Dr. Shaz, please, I have a question.
Yes.
Okay, the special note on the tax states that the mother is outside.
Yes.
Considering the fact that the child is 16 and she was the only one in the consultation room.
I know.
I know as long as she's able to understand what you're saying, you necessarily don't need the mother in there. But is it out of place to ask her if she wants her mother to be with her?
Actually, doctor, you're right. See, if there's something in the question, use it. You can say, I can see that you are come to the clinic today with your mother. Do you want your mother to be with you? Okay.
Okay.
Because she's 16. That's why, that's why everything in the question is for a purpose. Because if you mention this, she will say, no, doctor, I'm fine.
Okay.
So yes, you're right. And that's really good point that you pick up. I was about to say that, because that's why I mentioned that, a special note, additional information. So you know that you need to use it here.
Okay.
So when you go to the...
I am sorry, but I have something to say.
Yeah.
I didn't really notice that this is the BH. I heard it the TSH. So that's why my management was erratic.
Okay, no
But,
problem. No problem. Now you will never forget it. Because this case is really common. It's outside written as the same, that she's 16 years old girl, and you think that this case is hypothyroidism, or this may be the case with the, she's here for the pills or everything. No, when you ask the history, she's having clear-cut history of diabetes, polyuria, polydipsia, tiredness,
Hello.
isn't it?
Yeah, I just wanted to ask a
maybe
question.
Yeah.
Everyone is saying that it's DKA, but as you said, it's diabetes, right? We don't have the
No,
criteria of DKA
no,
completed.
no. It is DKA because she is undiagnosed case of diabetes.
But she is not. She's isn't in critical condition, or we don't have even the criteria of DKA completed yet.
See,
And
she
the
is,
urinalysis shows ketones,
yeah,
so that's
see,
already one of it,
yeah,
and also shows
ketones,
glucose.
yeah, lymphocytes, neutrophils, pH is low. She is in situation, you have to send her urgently to hospital.
Doctor, do
Yeah,
we
and
use to
we are still
manage diabetes?
Sorry?
Do we need to manage diabetes also in this case?
You will say to her, well, after talking to you and after looking at the investigations we have done for you, what I am suspecting that what I can see is that you might be having some infection, okay, in your blood, because lymphocytes, leukocytes high, and I have found some proteins in your urine, which we only find in conditions when a person is having high blood sugar. Okay. Okay. So I'm really concerned about your health, and that's why I want to send you to hospital urgently. Now you mention her what they will do there. Hello, can please mute yourself so we can talk?
Doctor Saima, lots of mic are like on. You can mute them all.
Dr. says you are the host. You meet everyone.
I'm just looking where I can mute them all. Sorry. Here's the link to mute them all. I'm really bad at
I
this.
think I did
Just
good
go
luck
to
by sending her to the
participants,
hospital.
go
Sorry?
to
Going to
participants,
going to
and under it,
participants.
you
Yeah.
see invite and mute all, then you mute all there.
Okay. Thank you. Invite. Okay. But this is saying invite only. Okay. Yes. I see them. Now better?
Yes.
Yes. Okay. So you will not say that she is having diabetes now. You say what I am suspecting, that you might be having some infection in your blood, and because we have found a protein in your urine which is present in certain conditions. One of them is diabetes or high blood sugar. Okay, so I want you to refer you to hospital to get checked and to be treated there, as this might be a serious condition, life-threatening condition. Okay, and then in the end you should mention then, well, I will discuss this with your mother. Would that be okay with you? Because you have to ask her permission.
If I understand clearly, it means that nothing is going to be done in regards to treatment for this patient in the GP clinic.
No, because she needs to be admitted. She needs, because she needs IV fluid, she needs insulin, she needs antibiotics in the hospital, she needs a scan of the abdomen. to make sure everything is fine with you, with her. So that's why we have to refer her urgently.
Yeah.
But use information of the mother. Say, I will tell your mother about your condition. Are you happy with that? Ask her. You will get point in IPS.
Okay.
Don't say you will send her. How you will send her? She is here with her mother. So ask her.
Mother.
Okay. Involve her as well for your
Thank you.
IPS marks. Yes. Yes, doctor.
I think what I mentioned right was sending her to the hospital.
Yes, you did really good
And-
thing actually. See, you just missed the diagnosis. You did send her to the hospital. That's okay, no problem. Don't worry, you will now never forget this case. Just keep in mind. Okay.
Dr.
Okay,
Shaz,
thank
I
you.
have a
I'm
question.
sorry.
Dr. Shaz, I
Okay.
have a question.
Yes.
Dr. Shaz, please. She's 16 years old.
Yes.
We will need the consent of her mother before we send her for treatment.
Why?
Since she's 16, I
So
thought
see here.
16-year-old
Okay.
can.
Let's just let's clear your mind up. There is nothing ethical scenarios here. This is an emergency situation.
Okay.
When there is an ethical scenarios, there you have to think about the competency, competency, she can give the consent or not, because her mother is already there. So definitely you will involve her.
Okay. Okay.
But
Okay.
this
I get you.
station is to make sure you pick up the emergency situation.
Okay.
That's and another thing is, she is 16, so
Okay.
talk to her like a child. Talk to her.
Okay.
See, and in the history, you should rule out hypothyroidism. Are you feeling cold?
Okay.
Okay, like this.
Okay.
Are you feeling any heart racing? How's your
Okay.
bowel habits? To rule out hypothyroidism, isn't it? You have to rule out some DDs as well. If you follow your structure of tiredness, you will not be lost.
Okay.
Do we have to safety net, doctor?
Safety net, well, you are
Do we have to
sending the
safety net?
well, you are sending the patient to emergency through the ambulance. So why you will safety net her here?
And what about, like, do we have to call for a follow-up?
Well, you are refer her. You can say that, well, when you get better, when you were discharged from the hospital, we might need to see you again in the clinic. If you want to say, because of obviously she will come back to you, isn't it? You're a GP. Hello?
Yes, doctor.
Yes. So just
Yes,
say,
yes.
well, after you have been seen and treated in the hospital, we will make a further appointment for you to make sure everything is okay with you. That's it. You are done.
And if this case was in accident and emergency, then we need to send her to the GP for follow-up?
Yes, you can do that. Yes. But you will not have that much time to think for that, because you have to say so many things. This station is not just about uh, finding out the emergency situation. It is also about dealing with a minor, how you talk to her, how you answer her, how you acknowledge her, because there are so many things going on with a child. She's just 16, so you have to this station is for IPS and plus emergency. You need to pick the emergency. You have to have a good IPS. You will get good marks. I scored 11 in this station. I did nothing special. I just talked to her like I talk to my kids, Are you okay? How's your study going? Are you talking to your friends? Did you tell anyone else? Or you can ask,
If this you have to elaborate on the
sorry?
Hello?
Yes?
Yeah, I say this was in an accident and emergency department. you might have, are we supposed to, of course, I think we should, elaborate more on the management plan, like the food and all of that.
Yes.
Okay.
Yes. So in these type of scenarios, when there is a minor, means when there's a 16-15, try to make IPS, talk nicely, you will get good marks in the IPS as well. Okay. I hope the session is beneficial for everyone. I don't know.
Very.
Yes, it's very beneficial.
Yes.
Very good, doctor.
Thank you
Thanks
so
a
much.
lot. Yeah, thank you so
Thank
much.
you so much.
Dr.
Yes.
Shaz, I'm sorry. I didn't get the other doctor's point on these scenarios where we have to send them to the hospital.
Yes.
Do we need to safety net?
See, your job is to send her to hospital straight away. Then you, because this scenario is both, because her mother is there, you have to mention her mother as well in the end, isn't it?
Yes.
Because you have to explain her condition to her as well. So safety net, what you will safety net her here? Can you have any idea, please? Tell me. Because she is going to the hospital straight away.
Hospital. Okay.
Because here mother is there, so involve the mother from the start to the end. Don't ignore her. Don't ignore her presence. She is there as a third person.
Okay.
Yes.
Right.
All right.
I have a question.
Yes, doctor.
Yes. So when I enter the room to take the exam, can I possibly put the question on my lap so that maybe I can be looking at it from time to time, or it's not allowed?
You can do it. They see you are the doctor, your clinic, you can hold the paper in your hand. Why not? You are a doctor. You the in charge.
Okay.
You the in charge there. So see, because it is very difficult to remember the name of the patient, because you finish one station, you go to next station. So always, if you don't remember the name of the patient, don't worry, the paper is always there on the table. It is for you. The question is there. So when you wait outside the cubicle, try to look at the question. Just remember where you are and what you need to do. What's your plan? What you want to do inside? Okay. Name is already there. Yes.
You said we can keep it on our lab, but do they mark us down if we keep, do we have to excuse every time, or do we just, just for a flick of a second, you see it and then get back? So do they mark us down on that?
No, they will not, unless and until you just keep, looking the paper. No, just give it a glance, keep it in your hand, and off and on you can have a look. Just but look at the patient. Don't ignore him. Don't miss anything from the patient. That's how you can do. They will not deduct marks. No.
Okay, and for cases like wherein the CT is kept in, the X-ray is kept inside, or ECG is kept inside, so or it's a test result thing. So what do? You go in, you excuse yourself, you see the result, then you start your consultation, or is it you start your consultation in between? You say, "Excuse me, I need to see the results," then, or like how does it go about? I mean.
No, you go there, you introduce, you say, okay, so well, because from the question, that he or she is here for her blood result. You can say that, well, from my notes, I can see that you are here for your blood result. Yes, doctor. So before discussing the result, is it okay if I can have a bit of chat about your health, please? So you will say, yes, doctor. If say no, then you can pick up the chart and you can tell. If she says yes, you can take history, just get a bit of idea. So when you ask the history part till Maftoza, when you say, well, I have got your result with me now. Now hold the result in your hand and tell her what you have found. Tell the positive finding and the negative finding.
No, what I'm asking is, when do we read it? As in, we should have an idea, as in, so we know what history we're taking, right? So
no. If you want to see, you can see it. But you need to see in the result station, there are 4 marks for the history as well, for the data gathering.
Yeah.
So always take history first, and they will definitely tell history. They will not say no to any. No, they will let you tell the history. So,
Alright.
okay, so ask the history. See, you are asking them, is it okay if we can have a talk about your health first? She will say yes. Okay, so why did you go for these tests first? So you will know in your head what's going on, isn't it?
So basically, the results will be there outside as well, yeah, outside and inside, and then we go on take history, tell the results, and so on and so forth. Yeah.
No. The results are inside. Outside is a question. She is here for a result.
Oh,
Talk to her,
okay.
discuss the result, and make a plan for the management. Whatsoever is the question. Result
All
are
right.
not outside. If it is a
So
result of
even we don't
question.
know what the result is. My
No.
question is, if we don't know the result, we are taking a generic history, right?
Yes. You take your medicine history, you take your general history, why she went for this. She will tell you everything. Then you pick up the notes. Okay, yeah, because it is a counseling station, isn't it? But you have to
Yeah.
take a bit of history, quick history. Why did she go, okay, for this? Then you ask how she's feeling now. Has anything changed since then? This is in okay.
So
Now the counseling station is like the past, present, and the future. That's the structure
yeah.
of counseling structure. The past, why did you went there? How she is now, what you will do for her now. Okay?
So like the mock you did, like the one wherein you have to start the patient on statins and the BMI is 37. So in case they don't tell us outside, I
No.
mean, we have to specifically take history of, it's better we take history of diet and physical activity, smoking alcohol, then we start taking, medical history, any other problems. So my basically we don't see the results inside in the beginning. We just start off with the history, then we excuse ourselves, take a look, and then say that is what the whole thing is. I'm just asking what happens in the exam.
Yes, Dr. Amrita, that's right. Because take history first. When you see the question, you get an idea what is the scenario is about. If it is lifestyle, isn't it? You know that you have to more focus on the lifestyle questions.
Yeah. All right. Fair enough.
Yeah,
Take it.
that's how it is. Yeah.
Okay. Thank you.
No worries. Thank you so much. All right.
So when we are inside, can we say that let me have a look at your results? Like take some time, 10, 15 seconds to look at the results. Like if it's a CBC report and there is a low hemoglobin and MCV is raised. So can I say that I need just have me look at the results, because I can't look at the results and keep on talking to her. It will mix up things. So I won't be able to focus on that. So can I just say to the patient, okay, now let me have a look at your results, and then after a look, then I can say, okay, so look, by looking at your results, these are your findings.
Okay, so see, you just try to be clever. When you ask the history, why should he go there? What happened? Now you're asking him how she's now, how he's now fine. Now you hold the paper in your hand. Now you say, okay, so I have, see, you are talking to her and you are also looking. You say, well, I have got your result with me. What I can see is this, that your hemoglobin, it is low. See, you are reading in front of her. Okay.
Yes. Okay.
Like you have to do
Okay.
like this. Don't, like, you are not there to read on your own, because there's a second person is there. Don't ignore him. Pick up the paper and tell, well, I have got your result with me. What I can see is your cholesterol, the bad fat in your blood is high, isn't it? So see, that's how you have to tell her or him.
Okay. All right.
Yes, hold
I
it
get it.
in your hand. Yes, no worries.
All right. And the other thing you mentioned before in the previous station, the 16-year-old child, you said that you asked the child that, how are you doing? Have you told any of your friends? Do you play and stuff like that? When did you ask these things? In the social history, in the start, or how do you ask such things? Like you said that just take the history as a child. So how do we do it? Can you just give a little bit of idea about it?
Yes. Okay. See, when I went to the keeper, okay, I introduced myself. Okay, what's your name? Okay, so how can I help you? Your tone should be like very, very low. How can I help you? Well, doctor, I'm tired. I'm feeling I'm feeling this for, okay. I'm sorry to hear. So how you're managing? Yes, yes, doctor, I'm unable. 5 minutes. Okay, okay. So, well, so you asked, so I can see that you are here with your mother. Is that right? Yes, doctor. Do you want me to call her in the room? No, doctor. Okay. So you have taken her consent as well. No. Okay. Now let's come to you to the tiredness. Can you please just tell me more about your condition? Then she will tell you about how she's feeling, because she will not tell you anything except tiredness, uh, going to the loo, and drinking more water and sleeping all the time. That's it. That's her history. So you have to ask, DD is here. Okay. So do you have any heart racing? No. Do you feel cold when others are feeling normal? No, doctor. Okay. And do you have any uh, diarrhea recently? No, doctor. Any constipation? No, doctor, I'm fine. Okay, that's fine. Because she is 16, so just omit smoking and alcohol, because she will not be doing it. So don't waste your time there. Okay. Okay. So now you're having this for a long time. So how this is affecting your studies? Are you able to go to university? No, doctor, I'm not able to go to university. That's really upsetting. Okay, so how you are catching up with your studies? She will tell you, yes, doctor, I'm talking to my friend on the phone, this and that. See, like this, you have to do it. Are you getting me?
Yes, yes, I got it.
Because there is not, in this station, history is quite short, because she will not give you anything positive. Everything is negative. You can ask family history. Any family history of medical condition? No. Do you take medication and any medication? Any allergies? No. That's it, is finished.
All
Okay.
right.
Yes.
All right.
Because then when you give her diagnosis of, you need to make sure that you check on whether she's understand or not. Okay. Now,
Yes. Okay.
there is another station in which is the same station, but there is 32 years old lady. She's coming to you, and in that station, she doesn't want to go to hospital. It is the same station, DKA. She doesn't want to go to hospital. So there you have to use your refusal approach. There are two stations. One is this one. One is a lady coming to you and she doesn't want to go to hospital. This girl, she will go to hospital. She will not say anything to you.
All right.
Okay. All right. Okay, then thank you so much for joining. Okay, and
Thank you.
thank you so much. And if you have any question, just please, message in the group, and we will be having more session, inshallah. And if you want to do any particular sessions, just let me know. I will try to do this. Yes, Dr. Munib.
Thank you.
Thank you so
No
much, Dr.
worries,
Shah.
no worries, no worries.
Thank
Yes.
you, Doc.
Thank you, doctor.
Thank you. Yes, Dr. Munib. Dr. Munib was.
Thank you, Dr. Shaz.
No worries, Dr. Bumari. Oh, okay. Do you have a list of these stations that you can share
Thank you,
with
doctor.
us? Okay. I will try to share with you stations. Okay. Yeah.
Doctor, I needed to ask one question if you have the
Yes,
time.
yes, I have time.
Yeah.
Yes.
Yeah. So, like 16-year-old, the ones wherein they come on for OCPs or morning afters, there is Gilix. So I wanted to know, less than 16, sorry. So I wanted to know, are there any specific set of so and so questions, or do if we see if she understands about why she wants the medicine, what happens if she doesn't take it, even if she does not understand parts of STI, but she understands she'll get pregnant, and you would try and tell her you should tell your mom. If even that much of assessment we do, is it all right to give her the medication, or are there certain specific, n number of questions we have to ask and n number she should understand so that her competency is identified, that that she is competent?
Okay, see, for the competency, one question is enough. If she knows that if she don't take the pill, she will get pregnant, when she knows everything, isn't it?
Yeah, so that's all right. Yeah.
So you don't need to ask, further. She doesn't want to tell her mom because of some, other reason, because she is maybe scared, maybe worried. But if she know what the consequences are not taking the pills, she is competent. You don't need to ask
Yeah.
further question.
All right. Yeah, that's what I wanted.
Because
to
the essence of the station is not like this. It is to, if you see that she's in danger, you have to involve social services. Okay.
know.
Because the people waste so many time in asking the question which are safe to take the pills, and they miss the main core of the station.
Yeah, fair enough. Yeah, I wanted to ask that only. Thank you.
Yeah, no worries. Okay, guys, thank you so much for joining, and I will post the link for the survey. Please kindly do it for me. Thank you. Thank you so much.